I am going to introduce her right now. Congresswoman Mary Bono Mack was first elected to the 45th Congressional District of California in 1998. She has established herself as a leader on cutting-edge issues, including clean alternative energy, protecting the environment, improving health care, and protecting consumers. She currently sits on the prestigious Energy and Commerce Committee. Throughout her career, Congresswoman Bono Mack has sponsored numerous pieces of legislation, including bills that provide funding for nationwide obesity studies and improved nutritional programs, autism research, and federal funding for the Ryan White HIV/AIDS Act. This is the first year that we have Congresswoman Bono Mack joining us at the forum. We're thrilled and honored to have her, and believe me, she is going to be the next big champion for our field. Welcome, Congresswoman.
Good morning. I guess with this crowd, I should start with, hi, I'm Mary. It says, there's a sign here, please do not adjust the microphones. You're breaking the law. You're breaking the rules already. I just started. Okay, so hi, I'm Mary. And good job. I was wondering if you guys are going to be awake yet. You know, I'm a California representative. I just flew in last night. And, you know, I am an unusual representative. I came to Congress, you might know my story, and you might not, but I came to Congress in an unorthodox way. I'm one of 4 widows currently serving. And Sonny Bono was my late husband, and you hopefully know the story. But when Sonny passed away and people came to me and encouraged me to run for Congress, I had to think long and hard about whether or not I could first fill out his agenda, but secondly, begin my own and take on my own set of issues. And along the way, I've been a member of Congress now for 11 years, which is hard to believe, but my set of issues have definitely transferred a long time ago. I think Sonny's agenda, we were very successful in getting it passed. And since then, I've had to find my own issues, and it's been quite easy to do. But one of them, high on my list of priorities, has been your issue. And I'm so happy to be with you all today, and I'm lucky and proud to be the representative for the Betty Ford Center. But I've also worked with Cirque Lodge in Utah and read a lot about what all of you do on the grassroots effort. You might know that timing is fortuitous. This week, there's a People magazine article about my son and his battle with addiction to OxyContin, which then turned into a struggle with ultimately some heroin. So that is out this week. So I stand before you as codependent, that's me, but also mother, daughter, wife, former wife, widow of. Addiction has swirled around me my entire life. I'm so impressed with the work you all do to raise awareness about the dangers of drug use and mobilize people to take action in your communities. You are making a difference, and I'm very grateful for all that you do. I come to you today as a member of Congress. As I just said, more importantly, though, I come to you as a mom. As some of you may know, as I just said, my son has struggled with addiction, and his journey has been a very, very difficult one for me. But it has also made me stronger and has taught me more than I ever wanted to know about addiction, drug prevention, and our drug treatment system. I'm committed to being a voice for you in Washington as we take up... I want to be your voice as we take up very important and comprehensive health care reforms. As you know, drug, alcohol, and tobacco abuse cost this country $500 billion each year. That's billion with a B. $500 billion each year. And in this economic climate, we can't afford to sweep the problem under the rug any longer. But I need your help talking to my colleagues, helping them to understand the very high cost of inaction and to understand that drug and alcohol addiction is preventable and treatable. In terms of substance abuse and addiction, there are 3 leading priorities that I want to focus on in this Congress. 1, increasing our national effort to prevent drug abuse. 2, secondly, working to include substance abuse prevention and treatment as part of health care reform. And thirdly, increasing awareness about the dangers of prescription drug abuse. You know, this People magazine article that we just did, my son was concerned. There's always risk when you speak publicly about something like this. But she stopped me to thank me for the article with a tear in her eye, and to thank me for my courage, and more importantly, my son's courage for sharing his story. And already I'd seen that just by talking about this issue publicly was helping somebody, and that the tear in her eye served as further inspiration for me to continue doing my job. But prevention is key. If we can get a child through age 21 without abusing drugs or alcohol, they are unlikely to develop an addiction problem as an adult. We must therefore keep our focus on increasing the age at which children and youth first use alcohol, tobacco, and drugs. But in order to do that, we need to take prevention seriously. The first step is pursuing funding for programs that work. Since 2002, funding for substance abuse prevention has decreased by 25%. That isn't smart budgeting. We know that every dollar invested in prevention saves between $2 to $20 on the back end. And kids need to hear strong prevention messages from every direction, from their schools through the Safe and Drug-Free Schools programs, from their communities through the Drug-Free Communities program, and in the media through the National Youth Anti-Drug Media Campaign. So no matter how great each of these programs is, none of them can alone eradicate drug use. We've come to learn that there is no silver bullet in prevention work. In order to raise the age of people that start using and lower overall drug use, we need all of these programs to work in tandem, reinforcing the same message to kids over and over again. But as all of us here today know, government programs are not necessarily sufficient. Communities also have a vital role to play, as I know all of you understand. When schools, law enforcement, businesses, the faith community, and others collaborate on community-wide initiatives, they can move mountains and yield impressive outcomes. Parents and families are also critical. Moms and dads need to talk to kids about the dangers of drug abuse, intervene when there's a problem, and find help for a kid in crisis. Research shows that kids who learn a lot about the dangers of drugs at home are up to half as likely to use. That should serve as a huge motivation to parents that, despite what we think, our kids are listening to us. But most parents don't know where to begin. When parents think their teen is using drugs or alcohol, there's a feeling of shame and isolation. When I needed help talking to my son, I, like many others, turned to the internet. I found great resources at drugfree.org, where I got good information to help me understand the problem, as well as advice about everything from how to start the conversation to how to eventually confront him. So the newspapers are full of stories telling us that the health care reform will be the major policy initiative in the next year. I believe that it is critical that any reform measure address substance abuse prevention and treatment. And as I mentioned earlier, substance abuse costs our country $500 billion a year. Even if you only think in terms of cost savings, you cannot deny that we need to address prevention of this problem in any comprehensive reform measure.